Meaning to be born again, Renaissance is one of the periods when great pieces of art like Mona Lisa by Da Vinci, The Birth of Venus by Botticelli, and David by Michelangelo came into fruition. Interestingly enough, this was also the time when many advancements were made in science and medicine, and more specifically, in anatomy. I am Justin Charles Von Possel, and we will be talking about medical advancements during the Renaissance from years 1400 to 1700. We've previously talked about medieval medicine in Europe and know that it has been mostly theoretical with little scientific basis. And now we're in this period of Renaissance where sciences were given a closer look, advancing anatomy while discarding notions of alchemy, blind dissections, and superstition. From 1346 onwards, there was the pneumonic plague affecting lungs and the bubonic plague or Black Death that produces characteristic buboes. Cures for these were not found early on, so they kept to prayers, pilgrimages, and had plague doctors help in the isolation process. While leprosy shows the sufferers to be very disfigured and so were asked to stay away from people and asked to ring their own bell even if leprosy may not have been as contagious as it was thought to be. St. Anthony's fire shows to have gangrenous and bright red extremities because of indigestion of tainted rye. Patients were given St. Vinage and cooling herbs to soothe the heat. Amputations were performed on affected limbs. There were many personalities of this time that contributed to medicine. Looking at the notable ones, not only as a talented artist, Leonardo da Vinci studied the human brain, which would be later known as neuroscience. His research into the brain led him to discover aspects of medicine such as neuroanatomy, included the study of the frontal sinus and meningeal vessels, and neurophysiology. During his lifetime, Leonardo dissected at least 30 corpses to fully understand the human body, which led him to draw 50 pages of what was understood of human anatomy. Andreas Vesalius, known as the father of modern human anatomy, was the author of the influential books of human anatomy, De Humani Corporis Fabrica. He has also dissected dozens of bodies and made detailed drawings of anatomy including muscles, challenging the drawings of the late Greek Claudius Galen, like the notion that men have more teeth than women. He also disproved the belief that men had one less rib than women, and pointed out that the brain and nervous system were the center of emotion as opposed to the heart. Year 1561, Versailles student Gabriel Falloppio published a volume of anatomical observations about the structures of the skull, ear, and female genitalia. He coined the term vagina and described the clitoris and the later known fallopian tubes. 2 years later, on 1563, Bartolomeo Eustacio published his treatise Sibelius de Dentibus, describing the dental pulp, periodontal membrane, development of both sets of teeth from dental follicles, the trigeminal nerve, and more oral structures. He also had modern ideas on the treatment of periodontitis, such as scraping the granulation tissue to have the gingival tissue reattached. He discovered what is now known as the Eustachian tube and valve in the heart. Theophrastus von Hohenheim, known as Paracelsus, was a Swiss physician and chemist. He is a doctor known with having the miracle cure, as he studied inorganic compounds and tried to reduce some of their toxicity compared to using herbs and animal substances. He believes that God provided a remedy. He studied silicosis and tuberculosis in miners. The Paragranum in 1530 and Opus Paramirum in 1531 laid out his overall approach in medicine and surgery. Ambroise Paré, a French physician, is known as the father of modern surgery. He became a surgeon to the king and served 4 French monarchs. He treated wounds with a mixture of egg yolk, rose oil, and turpentine, and found that they healed better than with boiling oil. As for his surgical advancements, he reintroduced tying the large arteries instead of searing vessels with hot irons while checking hemorrhaging during amputation. He was the first surgeon who did not practice castration on patients who required surgery for hernia. He also introduced the implantation of teeth, artificial limbs, and artificial eyes, made of gold and silver. Again, I've been Justin Von Postel. That's it for today. See ya.